jump straight to the pharmaceuticals, I think, is a big mistake because they all come with side effects. So skills before pills.
The justification that I got from one of my friends that was diagnosed was that his brain doesn't make enough dopamine.
That's not true. We don't know that. That's pure conjecture. The science doesn't support that. The whole chemical imbalance theory, no psychiatrist will tell you that's true. It doesn't. That's just scientifically false.
Where did that come from?
It was a theory that has since been discredited with further research. We actually, you cannot find ADHD in the brain. There's no brain scan to say, there's no blood test. You go to a doctor, they will ask you questions, you'll take a little assessment, and then if you get whatever it is, 6 out of 8 of these criteria, by the way, very gameable, completely gameable, you'll get a diagnosis. And of course, many physicians, unfortunately, will cater to what they think the patients want because they don't want a bad review on Google that says this doctor didn't believe me, right? So they fear a bad review and they'll do what the patient wants. Furthermore, I think a big problem. Okay, again, this isn't black and white. I'm very much for a proper diagnosis. I'm sure that ADHD is absolutely real. Let me say that again. But if you go to a physician that does not also give you an undiagnosis plan, everybody thinks about diagnosis. What about undiagnosis, right? When you go to the doctor and you have a broken arm, they put on a cast and they say, come back in a few weeks, we'll take the cast off and you'll be healed. Where's the undiagnosis plan for ADHD? It should exist. It should exist. We should be able to help people overcome, and we see this all the time when people want to. I in my family, I've seen this. People in my family have been diagnosed with ADHD. They go on medication. They suffer from the consequences of some of the side effects. They go off the pills. Then they get to the skills. They learn the skills, and they functionally don't have it anymore. Remember, it is not. What I hate about a lot of people in the ADHD community, they feel like it's an identity, right? It is who they are, and that is so dangerous. We need to look at ADHD as something that is treatable, okay? It's treatable sometimes through medication. It's treatable through behavioral practices. We can learn to overcome many of these things because if it's not functionally hurting you, you shouldn't have a diagnosis anymore. But I think if you go to a physician that doesn't give you some kind of undiagnosis plan, which could take years, it's not an instant solution, but there needs to be some kind of plan to how do we make sure that this functionally doesn't debilitate you without medication as a constant course of treatment, especially when it has side effects. That's a big red flag.
The treatment is based on what people believe the cause is. So if I think the cause is a chemical imbalance or your brain is broken in some way, I can't create an undiagnosis plan.
Right. That's the problem. It's not. Look, people are cured of addiction. Addiction is a pathology. You have it for a while you're so addiction is a confluence of 3 things: the person, the pain they're going through, and the product that they are addicted to. But when any of those 3 things change, they're no longer addicted. I don't believe in this, I'm an addict for life. I think that's incredibly harmful. And you will be very hard pressed to find someone who's in the addiction treatment community who calls people addicts. We don't call them addicts anymore. We call them people struggling with addiction because we don't want to stigmatize them to believe that's who I am. What do people do when they have an identity? They conform to that identity. That's terrible. You struggle with an addiction for a while and then you are treated and then you recover. Why do we think that ADHD would be any different?
The BBC wrote an article this week, which is what sort of caused this discussion amongst my close friends, where the BBC said they kind of presented the idea that TikTok had been really driving an overdiagnosis, because on TikTok you'll see a lot of videos that say things like, if you have this problem, you can't focus on this, or you lose your keys a lot and you forget where you've put them, that's ADHD. It's kind of simplified the ailment. And the BBC wrote this piece sort of saying that, is it driving an overdiagnosis in culture? And I've seen, if I go on my social media, that's what I see. I see so much content around saying, well, if you've got this, this, and this, if you've got this habit, then that's ADHD. And that does concern me a little bit, because we both know that ADHD is a very real thing that can be debilitating for people that suffer with it. But trivializing it into small little...
Right. And if you look for it, right, it's recency bias. when you are looking for something, you'll find it. So if you know, do people who everyone who loses their keys from time to time have ADHD? Of course not. But if you are looking for it and you're saying, okay, I lost my keys, it must be this, or it must, I was having difficulty reading a book, it must be this. When that's repeated ad nauseum in the popular press, I think that's part of the dilemma. Whether the media is TikTok or traditional media, there has been, I think, a popularization of the diagnosis, and the more people hear about the diagnosis, the more they potentially will look for it. And I think the pendulum should swing the other way. Now, I don't think there's anything wrong with teaching the skills that could make ADHD functionally not a problem. But what's wrong with that? There's no problem. I think the problem comes in when we get people to identify. We hear this all the time. Say, "Oh, I have undiagnosed ADHD." Well, you haven't gone to the doctor. You haven't taken any kind of assessment. How do you know? Right? And even then, if you did one, there's some gray area there too. Or people say, "Oh, I'm so OCD." Well, OCD is a terrible pathology, right? It's not. I like to wash my hands more than others. I like to keep my room clean. No. That is a serious pathology. So when addiction, I think, is probably the most overused phrase. Addiction is a terrible pathology. But when people say, "I'm addicted to this, I'm addicted to that," it has two terrible consequences. One, it's, I think, greatly offensive to people who actually struggle with this disease of addiction. That's one big problem, or the pathology of addiction. Two, you are creating this identity for yourself as someone who is powerless. Addiction, the word addiction comes from addictio in Latin, which means slave. So you're a slave to something. So when you call yourself a slave to something, you're basically saying you're powerless against it. So using these medicalized terms and moralizing these terms, I think, is a really bad path.
Who stands to gain from this? I've sat here with so many health experts, and they tell me about the sugar industry and the smoking industry that published a lot of sort of media back in the day saying that sugar was good for us and cigarettes were good for us. And I think about this conversation around ADHD now. Who stands to gain from an increased diagnosis of people with ADHD?
Well, I don't want it to sound like the tobacco industry that was sitting in smoke-filled rooms plotting, but there are systems in place which benefit some groups over others, for sure. I mean, I think the psychology industry, the pharmaceutical industry benefits quite a bit. Again, I don't think they're sitting there thinking, "Oh, we're gonna convince people that that they should be diagnosed." But of course, there's incentives, and more importantly, there's no disincentives. I'm not so worried about the incentives. I'm not pointing fingers at unethical practices in psychiatry or in the pharmaceutical industry per se. What I'm worried about is, where are the disincentives? Who is saying, "You're diagnosing too many people here. It can't be that 10% of American children have ADHD. How can that be? Something fishy going on." Where are the breaks? Who says this doesn't seem right?
What's the most important thing you think we haven't talked about today that we should have talked about?
So we didn't talk about how to build an indistractable workplace.
Oh, okay.
Yeah.
I read a stat that you tweeted a couple of years ago that said nurses had managed to reduce the rate of mistakes when they're giving subscriptions by like 80% just by wearing like a vest that said "Do not disturb me."
Right, exactly.
Which is staggering.
So that's where I got the idea of that screen sign that comes in every copy of the book. So these nurses in the UK, actually, it was this huge problem of prescription mistakes, that patients were being prescribed the wrong medication or the wrong dosage of medication. It turns out that in almost all cases, it was caused by distraction. They were, on their dosing rounds, and somebody would tap them on the shoulder and disrupt them, and then they would make mistakes. And the solution was that they had these nurses wear these bright red vests that says "Drug round in progress, do not disturb." And they reduced the percentage of prescription mistakes by 88%. They almost eliminated the problem. And so I tell the story. I know that, not everybody who reads the book is in the medical profession, but I tell the story to illustrate, one, how we too don't realize the problem is happening until it's too late, right? We think we're doing our job, we're doing great, everything's fine. And just like these nurses, not until they came back to work the next day did they realize, "Hey, did you realize you gave Mr. Johnson the wrong medication? You almost killed the man," right? In that case, they got that immediate feedback, and it's awful, life-threatening. For us, we don't realize how much better we could be at our jobs or at life when we work without distraction. There's a whole section in the book on building an indistractable workplace. We found that there's 3 characteristics of an indistractable workplace. The first is that there is a sense of psychological safety. This comes from the work of Amy Edmondson at Harvard. And she's identified that psychological safety is this ability to talk about your problems without fear of retribution. So if you can't raise your hand and talk about the problem of distraction, hey boss, I'm really having trouble finishing my work because I constantly feel I'm interrupted. If you can't talk about that problem, that is the problem. It's not the technology, it's that you can't talk about the problem. So number one trait, psychological safety, the ability to talk about the problem. Second is a forum to talk about the problem. So a little sidebar, Slack was one of these products that a lot of people complained about when I was researching the book. And I said, what do you find most distracting? And Slack kept coming up, or other group messaging services, but Slack is the biggest, or was the biggest at the time. And so I went to visit Slack. I went to Slack headquarters in San Francisco. And I expected, if Slack is this super distracting technology, well, nobody uses Slack more than Slack. I expected to see an office full of people who were constantly distracted. But that's not what I found at all. That at Slack, the parking lot clears out at 6 p.m. And if you use Slack on nights and weekends, you are reprimanded. You are told that is not what we do at our company, right? And what I found was that they exemplified these traits. There's another company I profile in the book, but Slack is one of them. So they have psychological safety. They give people a forum. That's the second trait. They give people a forum to talk about the problem. And so they created Slack channels where it was called beef tweets. They had a Slack channel where people could post complaints or suggestions about the company. And so what was important about this as a practice, it doesn't have to be on Slack. Some companies, I profile Boston Consulting Group as well. They had a massive turnaround as well when it comes to their company culture. They went from one of the hardest places to work. It was my first job out of college. It was really rough from a work-life balance perspective, to now it's one of the best places to work, according to, they got an award for one of the best places to work in America. And they did that by creating a forum, by creating a place to talk about the problems.